Welcome to Module 3 of the course Healthcare Policy and Financing. This module's content is the growth and evolution of managed care in the United States. The module objectives include discuss the perspective of health insurance from the view of the managed care organizations. This is a very distinct perspective based on the functions and key characteristics of managed care, and also to evaluate the concept of capitation in relationship to managed care organization reimbursement. And we will discuss the definition of capitation and how it's central to the concept of managed care in a few moments. Let's take a few moments to discuss the origins of managed care in the United States. In the early 1900s, a clinic in Tacoma, Washington offered broad-based medical services prepaid for 50 cents per member per month, really recorded as the first capitated rate within the United States. In 1929 and the early 1930s, Baylor Hospital in Texas agreed to provide prepaid benefits to teachers. And this was sometimes referred to as the Baylor Plan, and it really is the origins of the Blue Cross networks within the United States. Now we fast forward to 1973 and the enactment of the Federal Health Maintenance Organization Act. This was at a time that healthcare costs in the United States, unlike in the present world, were escalating far higher than inflation. And the federal government was looking at ways to slow down the Medicare expenses. At that time, the Nixon administration consulted with Dr. Paul Elwood, a noted health economist who had many articles and forwarded concepts of managed care, and many of his concepts became part of the original Health Maintenance Organization Act. He's also considered the father of the modern HMO movement, and again, that was back in 1973. The major feature of managed care is capitation. Let's for a moment discuss the definition of capitation, and it's a form of prepaid payment for healthcare services whereby a healthcare provider, whether a hospital, clinic, other provider or physician, is paid a contracted rate, and these rates are usually per member per month, prepaid for each patient who is a member of the plan or group for which they've agreed to provide services. The provider is paid this rate per patient, whether or not they provide services, no matter which services or how much or how little services they provide. Beneficiaries in a capitated rate are limited to providers who have agreed to participate, so a controlled network. The economic characteristics of managed care, and this can be found in your textbook, there are four characteristics, and this could be also for insurance in general. Selective contracting, and it's really to control the provider group for quality and cost. The steering of enrollees, and that's the insurance concept of adverse selection. Obviously, if you're paid a fixed fee per month, you want the healthiest individuals in your plan. Quality assurance, and that's setting the standards and best practices, again, to improve quality and cost. Utilization review, and that's retrospectively and prospectively, and that's review of your activities as a means of quality control. The assignments for Module 3 include discussion on managed care. The first line of the discussion is the government policymaker is strongly in favor of the managed care model. This is a throwback to a few slides ago in 1973 and the enactment of the Health Maintenance Organization Act. That came at a time that the government and government policymakers were looking at ways and mechanisms to reduce the overall spending in the United States, and Medicare in particular, of healthcare cost. And in today's world, it still applies, that we're still looking for ways to ratchet down healthcare expenditures in the United States. In this discussion, pay particular attention to your assigned role because each role is directly affected by managed care and capitation and responds differently. The second assignment for Module 3 is the group project, the member roles and a task. You're to assign roles and tasks to your group and begin working and discussing your project. Final comments for Module 3. Make sure you understand the concepts of managed care and capitation in particular, and how it differs from the traditional fee-for-service model. And also, can't emphasize this enough, begin interacting with your fellow group members, determine the mechanisms for communication, and begin to talk about and to organize your project. Thank you.